On this edition of Veterans Health Watch, we'll focus on VA benefits and healthcare services for veterans exposed to herbicides during their military service.
We'll also talk about the symptoms, classifications, and treatments for veterans with diabetes.
Welcome to Veterans Health Watch, a program sponsored by the Veterans Affairs Maryland Healthcare System that provides the latest health and benefits information for Maryland's veterans, their family members, and the local community. I'm your host, David Edwards, and I'm happy to be joined by my guest co-host, Andrea McCoy. Andrea, thanks for joining us today.
And thank you for having me. I'm excited to be here.
And joining us now is Michael Scheibel, the director of the Baltimore VA Regional Office. Michael, thanks for joining us.
Thank you. I appreciate it.
Well, why don't we get started? I know that we're going to be talking a little bit now about some of the compensation and pension benefits offered by the Veterans Benefits Administration. So if you could tell us, what are some of the things that your office does to assist the veteran population?
Veterans Benefits Administration offers benefits and services to veterans all across the country through our 57 different regional offices. The benefits range from compensation, pension, education benefits, vocational rehabilitation and employment, insurance benefits, and loan guarantee benefits to purchase homes.
Outstanding.
So please tell me, how long does it normally take for an initial claim for compensation to be processed at the regional office?
It really varies. It depends on a lot of different factors, one being the conditions that they're applying for, the evidence that is available at the time they apply, if we have to do physical exams, for the conditions, anything like that. Right now, Secretary Shinseka's strategic goal for VBA is to complete all claims within 125 days by 2015.
I understand that recently the regional offices have started processing new claims for veterans exposed to herbicides. Can you tell us about this new process and these new claims?
Sure, Dave. Back in October of 2009, Secretary Shinseki introduced legislation that would add 3 new presumptive conditions to veterans who were exposed to herbicides in Vietnam. Hairy cell leukemia, some B-cell leukemias, Parkinson's disease, and ischemic heart disease were the 3 that were added, bringing the total of presumptive conditions to 37 in all.
And what evidence would a veteran need to provide for filing a claim for exposure to herbicides?
It's pretty much the same as any claim. You want to make sure that you provide as much information up front as you can. Any medical treatment that you're currently receiving would be great. It would help speed the process up. We need to make sure that the condition that's being claimed, not only for herbicide exposure, but any claim, is actually a diagnosed condition, and then we can link it somehow to the military service.
Well, and I'd like to follow up with what you just were talking about, and that is the processing of a claim. And I guess this would apply to all claims. Veterans out there that have claims, but specifically for Agent Orange, what should they do really to make sure that their claims are going to be processed quickly, both Agent Orange and all others?
The biggest key piece of that is to make sure that they provide medical evidence. If they're being seen by a private doctor, provide that evidence up front. That way, in some cases, we don't have to go through the exam process. We can use, we've got a form called a disability questionnaire, or a DBQ, that the veteran can take to their private doctor. The private doctor can fill it out, and then we don't have to do the exam. That is a big piece. As long as we have the medical evidence, that's the big key piece that we can get through.
Michael, is there any other information that the veteran can provide to assist with the processing of his claim?
Again, medical evidence is our big key that we really need. One thing specifically related to the Agent Orange exposure is proof that the veteran actually was in Vietnam or was in the inlet waterways of Vietnam. That has to be proven in order to prove the exposure to Agent Orange during service.
And Michael, I'm sure there are many of our veterans watching today, especially our Vietnam veterans, who have this question, and that is, what are the level of compensations for veterans exposed to Agent Orange?
Again, it's not just specific to Agent Orange exposure, but for all benefits. And it ranges on the condition itself and how that individual is being affected by that condition. The level of severity for that condition with this individual. It can range anywhere from 0% up to 100%. Some conditions are beyond the 100%, and we have a special monthly compensation that we add on top of the 100% rating.
Where could one obtain benefit information related to the exposure of Agent Orange?
VA has some great websites. The main VA website, www.va.gov. There is a site that's great, gives you everything you ever wanted to know about Agent Orange. It's www.publichealth.va.gov/exposure/Agent Orange.
You mentioned previously a term that I'd like you to define for our viewing audience, and that is presumptive conditions. Can you explain briefly what exactly does that mean for a condition?
Presumptive conditions are conditions that have been either through research or legislation have been decided that that condition, if it manifests within a certain period of time, is presumed to have been related to their military service. And each condition that is in this presumptive category, the time frames are different for each one.
Before we end our segment, could you briefly go over how a veteran who is watching today and needs to file a claim or feels they have a claim to file, what's that step? What do they do? Where do they go?
There's actually several different ways they can file a claim. They can go online to the VA website. They can go into eBenefits, is a new portal that VBA has established over the last couple of years where you can apply there. There is online applications. They can come on into our office and apply. They can apply through a veteran service organization. They can come into the healthcare centers, and there's people there that can help them as well. So there's a myriad of ways that they can apply for benefits through VBA.
Michael, is there anything else that you would like to share with our viewing audience today about veterans benefits and compensation benefits and information about the regional benefit offices?
I think, all the information that anyone would ever want to know about benefits can be found on the VA's website, www.va.gov. Also, they can call our toll-free number, 1-800-827-1000, and can get in contact with an operator that will be able to answer all their questions as well.
Outstanding. Michael, thank you so much for joining us today. I know we always get a lot of questions about VA benefits, so we thank you for taking the time to being with us today.
Yes,
thank you for having me.
Sharing this information.
We're going to take a short break, but when we return, we'll be talking about some of the healthcare exposures of Agent Orange, so stay tuned.
I was homeless with a bag of clothes over 2 years ago.
We have outreach workers, licensed social workers that go out into the community, and they provide assessment, referral, case management services to our homeless veterans. We provide almost anything that the veteran needs in order to try and get him back off the street and back into society.
And I call my mom every day, and she hears it in my voice. She says, "You're alive now and you're living." These people, from a nurse to the guy mopping the floors, they all have one thing in common. They save our lives. I work my incentive therapy program, working in the mailroom. I feel like I am somebody now. It's hard for me to ask for help sometimes. Taking the buses around there, and I seen these homeless vets. And there's help. There's always help.
Welcome back to Veterans Health Watch. Joining us now is Dr. Sandra Marshall, the director of the VA Maryland Healthcare System's Managed Care Clinical Center, and Kevin Davenport, environmental clinic provider at the Fort Howard VA Outpatient Clinic. Thank you both for being here today.
You're welcome. We're happy to be here.
Previously, we were talking about VA compensation and pension benefits for veterans exposed to herbicide in military service. I'd now like to turn our attention to some of the VA healthcare issues associated with this veteran population. And Dr. Marshall, can you tell us now about some of the diseases and conditions that our veterans might have contracted from exposure to herbicides in military service?
Yes, one of the earliest medical conditions that was recognized as being due to exposure to Agent Orange was something called chloracne, which is very similar to the type of acne that we see in our young teenagers, but is something that doesn't resolve over time. Over the years, there have been numerous studies looking at the health effects of Agent Orange exposure, and it's been determined by the National Academy of Sciences that certain illnesses and diseases such as certain cancers, lymphomas, lung cancer, certain other conditions such as diabetes and prostate cancer, and even some heart diseases are related to long-term exposure to Agent Orange. We also know that recently the diagnosis of Parkinson's disease has been linked to Agent Orange exposure as well.
And how they did these studies was interesting, is that they compared people who served in Vietnam to people who served in Germany at the same time. And they came up with some statistics which shows that people who served in Vietnam were in general sicker than people who served in Germany.
Very good. That's a good point to know.
Kevin, I understand that the VA maintains an Agent Orange registry. Can you provide us some more details about this registry?
Yes, I can. There's a data bank that they keep in Austin, Texas. And what it does is it keeps information on veterans who have served in Vietnam, or specifically people who have been possibly exposed to the chemical dioxin. And they follow them along, and they keep this data for the possible use of doing studies in the future to see how they're doing and if they're sicker than people who were not.
Kevin, who is eligible for an Agent Orange exam?
The people who are eligible for the Agent Orange exams are people who served in Vietnam between 1962 and 1975. There's also a few other places that Agent Orange may have been used. For example, in Air Force bases in Thailand, certain parts of Korea, and a few other places where it was tested in America.
Any veterans who have questions about whether they were potentially exposed, they can go to the VA website, www.va.gov, and look for information about Agent Orange. And there's actually a link that gives the information Mr. Davenport was mentioning, the particular locations in Thailand. For those veterans who were on ships, and they were called brown water veterans who may have gone to the inland rivers, they may have had exposures as well. And if they have questions, they can certainly contact us at the VA Maryland Healthcare System and speak to Mr. Davenport at the Fort Howard Clinic. They can reach him at 410-447-1800, and we'd be happy to answer any questions.
Dr. Marshall, if there is a veteran in our viewing audience today that thinks they might have been exposed and they want to come in for an Agent Orange exam, what should they do? Where do they go?
Sure. They should call Miss Denise Mondowney. She's at the Baltimore VA Medical Center. She can be reached at 410-605-7325. And what she'll do is to schedule a visit for the veteran to come to the Fort Howard Clinic. And she'll additionally receive or ask for information from them so she can send them some forms. The forms are for the veteran to complete prior to the visit. There are questions related to where they served in the country, what kind of activities they were involved in, what their current health status is, and then it helps Mr. Davenport when he sees them complete the registry exam.
And I'd like to say that if they've never been seen in the VA healthcare system before, this is a good opportunity to be able to get your data into the VA system. The VA doesn't use charts anymore. We have computers. And what I do is I type all their information into the computers, which can be accessed nationwide.
Kevin, please tell us again, at what VA Maryland healthcare facilities are the Agent Orange Registry health exams offered?
In the state of Maryland, the only place we offer it at this time is Fort Howard, where I work. And if you contact Denise Mondowney, what you will get is directions on how to come visit me. And I see people Tuesdays and Thursday mornings.
And Dr. Marshall, while we're on this subject, what type of treatments are there available for veterans who have been exposed to herbicides?
Well, we'd certainly like to bring them in and offer them primary care services, and as part of that program, we would offer them treatment for their chronic medical conditions, whether they develop diabetes or prostate cancer or heart disease. We also offer health screenings. We offer particular cancer screenings. We do health education. We do wellness and lifestyle promotion. So we're really a comprehensive service so that whatever their healthcare needs are, we can address those and offer services. For those veterans who have unusual symptoms or diseases for which we have questions about whether they are related to Agent Orange exposure, the Washington, D.C. VA has a War, Injury, and Illness Study Center, and they can be referred there for specialty evaluation.
Very good.
Kevin, if a veteran wanted to learn more about the exposure to Agent Orange or other herbicides, even those outside of Vietnam, where would they call?
The VA has recently put together a new website, which is really an excellent website and very easy to navigate on how to find anything that you'd like to know, whether it be symptoms, whether it be how to get compensation, whether it be locations of where you were, and to see if you might possibly qualify. The website's on the screen right now.
Very good. Dr. Marshall, Kevin, before we end the segment, is there anything else you'd like to add about exposures, treatments, and other information for veterans that might have been exposed to herbicides during military service?
Well, one thing that we always bring up with our veterans is if you're not sure if you were exposed, contact us. We can help you sort through whether you potentially were exposed. If you have been exposed, you were in an area where the herbicide was sprayed, we can have you join our registry and receive services through our primary care programs and our other many services in the VA. We also do education and outreach for those who may have had children who have diseases related to Agent Orange exposure. And we also can do referrals to the Veterans Benefits branch of our department so that those who may qualify for disability related to the diseases they developed because of exposure can receive that information as well.
Dr. Marshall, Kevin, thank you so much for joining us today. This is a really important subject for our Vietnam veterans and other veterans in our viewing audience. So again, thank you very much.
You're welcome.
We're going to take a break, but when we return, we'll be talking about diabetes and how we can help our veterans population who are diabetic. So stay tuned.
Those veterans who don't enroll in care, many times if you ask them if they're a vet, they'll say no, but I did serve in the military.
Anyone that made that commitment to put your life on the line for others is a veteran.
The system is very accessible. For instance, enrollment. We have 3 ways to enroll.
You can enroll online, you can physically go into the VA and enroll, or you can telephone to enroll.
Doesn't cost anything to enroll. All it takes is a few minutes of your time and a copy of your DD-214. That's all you need.
I'm a veteran myself, and I tell the family, when you entrust the care of your loved one to me, you can go home safe and very at ease.
Best thing that you can do is just come in and apply.
Without a doubt, any veteran definitely owes it to themselves to enroll. You know, your health and well-being is priceless.
Welcome back to Veterans Health Watch. Joining us now is Joyce Campbell, a registered nurse and certified diabetic educator at the Baltimore VA Medical Center. Joyce, thank you for joining us today.
Thank you for having me, Andrea and David. It's a pleasure for me to be a part of the journey that veterans take in taking care of their diabetes.
Outstanding. Well, talking about that, I understand that there are over 21 million Americans with diabetes, according to the Centers for Disease Control, and that diabetes is on the rise in our veteran population. So can you start by telling us exactly what is diabetes and why is it so prevalent today?
Diabetes is a disease that affects the ability of the body to rid itself of glucose. We have an organ that's called the pancreas, and this organ sits behind your stomach. This organ is responsible for producing insulin, and the insulin is like a key to get the glucose from the food that you eat to go into the cells of each and every organ of the body to energize these cells. So your brain, your heart, your lungs, your kidneys all work properly. When people have diabetes, either they have no insulin at all coming from this organ, or they have such a small amount or an amount that is insufficient to energize the cells of the body, thereby affecting every cell of the body.
And is there any reason, though, why today we're hearing so much more about diabetes, and is it truly on an increase?
It is on an increase, and it has a lot to do with obesity. It also has a lot to do with lifestyle. The technological era is here, and it's great, it's fantastic, but it restricts people to sitting a lot. They're not going out, they're not exercising. Same thing even in the schools, which is outside of the VA system, but their level of activity has decreased tremendously, and this attributes to diabetes also.
Joyce, tell me, what are some of the risk factors for diabetes?
The risk factors for diabetes have to do with family history. If you have parents that have had diabetes, if you have grandparents that have had diabetes, it also has to do with ethnicities, race. African Americans are at higher risk for diabetes, as well as Native Americans, Asians, Latinos, and Pacific Islanders. And again, it has to do with those other risk factors of not being active and being overweight, because being overweight makes you insulin resistant. When you're insulin resistant, it means your body does not have the ability to utilize the insulin to get the energy into your cells to make your organs function properly.
And Joyce, what are the classifications and diagnosis for diabetes?
Actually, there's three. There's type 1 diabetes, used to be referred to as juvenile diabetes, which is not referred to anymore. It used to be only smaller young children had diabetes, type 1. Now older adults also contract type 1 diabetes as well. Type 1 diabetes is when the body is not producing any insulin at all, or it's such a small amount that they require insulin to maintain life. So this person that has type 1 diabetes must always take insulin. Type 2 diabetes, on the other hand, their body does produce an amount of insulin, but it's not sufficient to get the energy, the glucose into the cells to produce energy. They may have to take insulin and pills to keep the diabetes under control. And some people are also controlled when they are just following their diet and they're exercising on a regular basis. The third one is gestational diabetes, and this is for when the pregnant woman develops diabetes during the pregnancy. What happens once she delivers the baby, the diabetes appears to go away. If they continue with the same sedentary lifestyle, and they make unhealthy food choices, they can redevelop the diabetes. Again, there are higher risks for type 2 diabetes.
Joyce, what are some symptoms of diabetes?
Some of the symptoms of diabetes are unexpected weight loss, dizziness, they can have blurred vision or other visual disturbances. They'll have excessive thirst, excessive hunger. They're not going to have all of these, all at the same time, but these are some of the symptoms. Wounds that don't heal quite readily. Also, they develop lots of infections, one behind the other, because their immune system is compromised.
Joyce, you mentioned the issue with vision, and I understand that diabetes is a leading cause of blindness. So I'm sure that's a very alarming issue for our veteran population, especially those with diabetes. So what can our veteran population do to ensure good eye health?
Veterans can go in to see their primary care providers, and if they already have diabetes, their primary care providers is going to prompt them to have a yearly eye exam. The yearly eye exam is a preventive mechanism to make sure that the diabetes is not adversely affecting their vision.
You mentioned diabetic eye health. What other types of treatments or education can the VA Maryland healthcare system provide to our veterans with diabetes?
They have yearly flu shots. They also offer pneumonia injections for patients as well, because they are at higher risk for infections because their immune system is compromised. They also have in primary care concentrated education courses on diabetes education. We have in the diabetes clinic on the second floor a survival skills class for diabetic patients. The first hour of the class is taught by myself, the diabetes nurse educator, and it goes over the skills the patient needs to acquire to maintain their diabetic health care. The second part of the class, second hour of the class on Thursdays is taught by the dietitian that works with the diabetic clinic, and she goes into healthy meal planning, when people should eat, what they're eating, how to shop for foods, and to work with the veterans to help them make healthy food choices.
Joyce, who is more prone to get diabetes, and is it hereditary?
They say that it follows in families, and that if someone else in your family has had diabetes, they're more, that presents a risk factor for them.
Joyce, we're experiencing warm outdoor temperatures. How can our patients safely manage themselves during these warm conditions? Our diabetic patients, how can they safely manage themselves?
Well, if they have to go out in the extreme heat, we suggest that they try to get out as early as possible between the hours of 6 and 9 when it's not extremely hot. And when they do go out, that they wear sunscreen to protect their skin. The skin is another one of the areas that diabetics suffer with excessively dry skin. So they want to put sunscreen on before they go out. They also want to make sure that they're well hydrated and drinking water throughout the day, and drinking sugar-free drinks, and to avoid alcohol. Alcohol can help patients become dehydrated, and that's what we don't want to happen with them.
Joyce, if there are veterans watching today's show and they think they're having some of the symptoms that you mentioned earlier, what should they do to see if they may have diabetes?
They need to contact their primary care provider. Their primary care provider will evaluate them when they come in to see them, and the primary care provider can make the necessary consults if they need diabetes education, or if they want to refer them to the MOVE weight management program.
Outstanding. Joyce, thank you so much for joining us today. I'm sure the members of our viewing audience really learned a lot about diabetes and the services that are available from the VA Maryland healthcare system.
And thank you for inviting me, David and Andrea. It's been my pleasure.
That wraps up this edition of Veterans Health Watch. Thank you for joining us today. If you have questions about today's show, or you'd like to make suggestions for future topics, please contact us at 1-800-463-6295, extension 7101, or visit us on the internet at www.maryland.va.gov. You can also like us or friend us on Facebook and Twitter.
If you are a veteran or know a veteran who is not enrolled in VA health care, please call our Enrollment Center at 1-800-463-6295, extension 7324, or visit your local VA Medical Center, or visit us online. We hope to hear from you soon. Thank you for joining us.
Thank you.
Does the thought of going to the pharmacy, standing in a long line, and paying high costs for your prescriptions worry you? Well, the VA Maryland healthcare system provides a full array of pharmacy benefits, including 2 full-service pharmacies, convenient online and phone and prescription refill services, and reasonable medication co-pays for enrolled veterans. To refill or check on the status of your current prescription with the VA Maryland healthcare system, call 1-800-463-6295, extension 7395, 24 hours a day, 7 days a week.